We're going to do a demonstration to learn about using fentanyl test strips, and we have a recent graduate from our Master's in Public Health program here, Leo Andrews, and they're going to introduce themselves and explain a little bit about how to use the fentanyl test strips. Leo?
I'm Leo, work for the County Health Department. We do harm reduction services. So we provide fentanyl test strips, syringe exchange, and Narcan to the community and education, of course. So today we have fentanyl test strips, and these are really used for folks that are interested in or nervous about fentanyl. So often I'll have folks come up and say, hey, we have fentanyl test strips. And they go, oh, I don't do fentanyl. Well, then this one's for you. So it's pretty simple. You take a tiny, tiny bit of your substance and you mix it in with water. I recommend using a water bottle cap.
Are people usually concerned about wasting their drugs when you ask them to put it in the water?
Of course, of course. It can be tough if you're using substances and you don't have a lot of money. You don't want to waste any of it. But I always say just a tiny bit, and a tiny bit can really save your life.
And so they really are just using a small amount of that and no more water necessary than like what's in a cap?
Correct. So just a tiny bit. I took just the edge of this piece right here and took it, put it in here. And then you will look at the strip. In the strip, there's a blue part that has a little hand on it. That's what you hold on to. And the white part that has what looks like waves on it is what goes into the water mixture. And you let it sit for a second. It takes between 10 to 20 seconds. You can see it coming up through, and you'll see in the middle between the white plastic and the blue plastic, you can see the water come up.
So it's like just being absorbed up the arm of it?
Correct. And there's a little bit of time. The results will show up. So here we have our positive test. So on the back of the strip package, it tells you about a positive is on the right side. So we have a positive test here. A negative would be 2 lines. And then we have the invalid. So an invalid would mean that someone would have to try again. But today we have our positive test.
Do people have a hard time following the steps, or do they usually get some have to do it more than once when you talk to them afterwards, or are they usually pretty proficient in terms of being able to use the drug test strips?
I think a lot of folks, I haven't had anybody come back and complain.
That's true.
Yeah. So I haven't had a lot of trouble, but I think also this is a really new initiative, and we'll find more and more. Data takes time, and especially in our population, not a lot of repeat customers. And if you do, then it kind of takes some time for folks to trust and let you know what's going on after they use things that you provide for them.
And when you're giving them instructions or demonstrating how to use it, what kind of instructions or are they looking for? What information they get if it tests positive? How might that change their behavior in terms of what are they going to do next with their substances?
Part of harm reduction is not to tell people what to do.
Mm-hmm.
So we're really big on just letting people know. So they want to be informed so they can make their own choices, empowered choices of what they want to do with their drugs. So if it tests positive, they can either go low and go slow. Those are the big public health phrases. So you start low, use a little smaller doses, and go slow with your dose. So if you're shooting up slowly. As a health department, we don't advise people to do anything. That is not our business, and especially in harm reduction, that's not our choice. So it's about giving people the information so they have the power to do what they want. And throwing away drugs is the automatic thought, I think, for us, but that's not necessarily the case. And we really want folks to just do informed use.
Yeah. And are you finding that people who use who aren't necessarily using opiates and wouldn't necessarily expect to have fentanyl in their drugs, are you finding that people are also coming in and asking for test strips or using them with like cocaine or ecstasy or other drugs?
Absolutely. I mean, that's the population we're targeting. We are doing a nightlife project, so we're trying to get out into the community, and especially around here, cocaine is a big nightlife scene drug. It's more recreationally used. sometimes in crack too. Molly is really big around here. They call it Molly. It isn't necessarily traditional MDMA.
Yeah.
It's more similar to a stimulant like meth. And they'll freebase that, and a lot of folks are concerned about fentanyl with that. And spike is another really big thing around here, which is a synthetic marijuana. It's called spice in other places, but Syracuse is one of the biggest hubs for spike, and
Yeah.
folks are using this to test because that is not something that they're expecting. And when you're using opiates, it's a very different space. So a lot of folks who maybe are ex-opiate users are still just using spike or using some other substances, and they don't want fentanyl. So that's absolutely the population that we're looking to. It's mostly the folks that are worried about fentanyl, do not want fentanyl in their drugs.
So, if you're testing a leaf-based substance, so spike looks like cannabis, even though it's not, would they just like kind of crush it up in the water, like you were using cooking herbs or something like that,
Exactly.
and you can still test it or test the water, so
Yeah.
the residue would come off of the leafy substance or whatever.
That's the theory. And the spike is a little bit more ground up than traditional marijuana.
Yeah.
Because it's not. When I've seen it, it's already almost a powder.
Yeah. Okay. Yeah. I wondered how that would work.
Yeah, looks like it's sold as a potpourri.
Spike potpourri.
Yes.
Are people also seeking like naloxone or Narcan when they're getting test strips, or is it kind of two separate harm reduction strategies? How does that work?
So there's a time and place for everything, but we always provide together.
Yeah.
So when we're doing street outreach, we have the test strips. I always say I have Narcan, I have test strips. We also do syringe exchange at the same time. So when folks come in for that, often people will take everything that you need. And yeah, but the Narcan has, there's some other spaces where folks who only need Narcan go to. But often when we're providing test strips, we like to give them Narcan because you never know. Even it could be a friend, it could be somebody on the street. We really would love to have Narcan in every household.
Great. Thank you very much for the work you do.
Thank you for your time.